Explain the cardiac cycle. The cardiac cycle refers to the sequence of events that occur in the heart during one complete heartbeat. This cycle consists of alternating periods of contraction, or systole, and relaxation, diastole, that move blood through the heart and into the circulatory system. The cycle begins with atrial systole, when the right and left atria contract simultaneously, pushing blood through the atrioventricular or AV valves into the ventricles. This is followed by ventricular systole, where the ventricles contract forcefully. As the pressure in the ventricles rises, the AV valves, the tricuspid and mitral valves, close to prevent backflow into the atria. This closure produces the first heart sound, often described as LUB or S1. The semilunar valves, pulmonary and aortic, then open, allowing blood to be ejected into the pulmonary artery and the aorta. After the ventricles contract, the heart enters diastole, the relaxation phase. During early diastole, the ventricles relax and the semilunar valves close to prevent blood from flowing back into the heart. This closure produces the second heart sound known as dub, or S2. As ventricular pressure falls below atrial pressure, the atrioventricular valves open again, allowing blood to flow passively from the atria into the ventricles, and the cycle repeats. Let's clarify the terms systole and diastole. If talking about atrial contraction, you would call that atrial systole. However, if the term systole is said without any qualifiers, then it's referring to ventricular systole. For example, when we talk about systolic and diastolic blood pressures, we are talking about the blood pressures during ventricular systole and ventricular diastole, respectively. Throughout the cardiac cycle, the coordinated opening and closing of heart valves ensures that blood moves in only one direction, preventing regurgitation. The cycle is completed in less than 1 second, with the average heart beating about 70 times per minute at rest. This rhythmic cycle maintains efficient blood flow, delivering oxygen and nutrients to the body and removing waste products. Disruptions in this sequence, such as valve problems leading to abnormal heart sounds or murmurs, or arrhythmias, can impair the heart's pumping efficiency. Inefficient cardiac cycles can lead to conditions like heart failure, where the heart can no longer meet the body's demands. That's why assessment of heart sounds and understanding the cardiac cycle are critical in clinical practice.